Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We're going to be talking with two amazing guests today that are in the thick of using data for proactive patient healthcare. I'm so happy to have with me on the show today. I've got Eugene Khazin, who's the CEO of Prime TSR. Eugene is the founder and has been in digital transformation consulting. Prime TSR is Eugene's fourth company, and his background is in technology, particularly in big data, which has provided him a lot of opportunities for driving innovation across all of his ventures. I've also got on with me Nathan Pelzer, who's the founder and CEO of Clinify Health, who's for the last 15 years been working in various different corporate strategy roles before founding the company and headed up strategy for a national primary care provider organization in Chicago. Guys, welcome to the show.
Thanks for having us.
Well, great. We've got a lot of cool stuff to talk about today, and want to talk about the data side of the proactive patient healthcare and the value healthcare system that we've kind of seen this big innovation and things rising in. And want to start about, you guys are doing some pretty cool stuff in remote monitoring and care plans based on data, and then kind of taking some actionable insights out of that. Can you tell me a little bit about what you're seeing in this space that's really kind of identifying some of those high-risk patients and some of that predictive data insights that you're seeing from that standpoint, Nathan?
Yeah, sure. So first of all, remote health monitoring is a fairly broad space, right? You've got medical devices that have continuous uploads of data. For example, pacemakers these days. You've got virtual telehealth. And then on the long end of the spectrum, you've got applied data science to any of those hardware products that are working. So the second point is, with regard to remote health monitoring, technology in isolation is something that's only going to move the needle so much. So our focus is tying the technology to informed, actionable clinical guidance. We feel that that's the key to closing the feedback loop. So to that end, what we're doing at Clinify is we take patient clinical data in conjunction with social determinants of health data and apply proprietary models to develop recommendations of evidence-based care plans specific to each patient and aligned with the strategic objectives of our partners. So where we really feel that there's a space is, especially in the vulnerable populations, patients can fall through the cracks, right, and drop off the radar, and they end up in sort of a healthcare purgatory where they don't manage their condition and only rise to the attention of professionals when it's an acute emergency situation. So we try to close these gaps in care by keeping a constant eye on where patients are at from a clinical standpoint, from a behavioral and social standpoint, while providing that feedback loop to providers. And we've partnered with Eugene and Prime TSR to build and deploy our solution. So Eugene, maybe you can talk about how your team approached development of the platform.
Yeah. We provide the technology behind the Clinify solution. And the key is really is about combining the data, pulling it from multiple sources like EHR, the claims data, the socioeconomic data, and some others, and wrangling it to connect it all together and make it usable. So Nate's team created the actual models, the logic, and then our technology teams, the developers, they implemented those models in the code, allowing to provide those insights and at the end deliver the outcomes.
Great. That makes total sense. So, we talked a little bit about, you guys are talking kind of about the data. What historically, if you're looking at a hospital and you're looking at that clinical side, there's a bunch of different EHRs within, a hospital or a clinical setting. You've got all different types of data. What's the state of kind of the healthcare right now with so much different data in different places and really making that usable? And how have you guys kind of trying to solve some of that?
Well, so if you look at the industry broadly, like there is the FHIR standard that's been around for a little bit and people talk about it, but the adoption is still not there. And so to what you said, with multiple EHRs, with other data sources within the clinical space, it's really hard. It's not an easy task. I wish I could say it was trivial, but it's not at all. And it's quite a bit of work pulling it all together and combining those data sources and making them, the key is making them usable. It's not just, I got them, I stored them in some database and here you go. You got to go a step further if you want to keep people like to hire data scientists, for example, but to make them useful, they need the data and that data needs to be in the right format. So not a trivial exercise.
Yeah, it's definitely not a trivial effort. And, as there's been a lot of talk on a lot of this healthcare data, with it being HIPAA compliant and all that stuff, moving it to the cloud to make it a little bit more accessible and some more standards. What are you seeing, Eugene, with like some of this data? I mean, are folks having it on-prem? Is like some of it in the cloud? Like, what percentages of these hospitals like really have, data in the cloud that makes it more accessible or more, web services and things like that? And where do you see that headed in the future?
Yeah, so the direction is obviously the cloud. It's not a question of if, it's when. The trend is the hospitals with more money tend to pretty much, I would say 70 to 80% are already in the cloud in some form or fashion. But the hospitals, the safety net,
what percentage?
the organization that I would say 70 to 80%
are already in the cloud?
In some way, right? They're not all in, but
right.
I think
some
we've
portion
gotten
in the cloud.
Some portion of the data. And the key though is, in let's say 3 years ago, I was having conversations about, is it safe to put my data in the cloud?
Right.
I'm not having these conversations anymore because people are starting to realize that putting it in the cloud is probably safer than holding it in my own data center.
Yeah, no doubt.
Right. Amazon has thousands of security engineers looking at this stuff while your hospital has probably 2 people. And so it's just,
and that guy's out sick, right?
Exactly. But the smaller, poorer hospitals, they are all on-prem. The condition is pretty sad, and they wish they went to the cloud, but they just don't have the funds. So it's a matter of kind of enabling it in some ways, figuring it out.
Yeah, that makes sense. So Nathan, I want to talk a little bit more about some of the things you talked about earlier. As we see more and more kind of chronic care patients, you talked about, the population health and some of the underserved. And then we've got this whole population of, baby boomers that are kind of aging at home. It's created a lot of these needs for really proactive healthcare, right? And to not just kind of sit around and wait, but to take some kind of immediate actions based on data and based on things coming from that standpoint. Tell me a little bit of, number one, where you're kind of seeing the biggest opportunities in healthcare, if there's particular like medicine types or practice areas, things like that. And then, really how to use that data, and really kind of close that loop. So it's not only beneficial for the patient, but also, some of the payers.
Sure. So if you think about one of the biggest challenges facing healthcare, and especially facing the elderly generations in the aging population, it's the development of chronic conditions, right? So I think the statistics say that, by the time you're 65, there's a 70% chance that you have at least one chronic condition. We know that 90% of deaths are attributable in some form or fashion to an underlying chronic condition. And the management of these chronic conditions, based on the best evidence-based medicine out there, can be put into a programmatic approach. So we can use data to say, we know what you should be doing. We know what your medicine refill should look like. We know when you should be coming in for your annual checkup, when you should have a preventive screening. And through the use of real-time data feedbacks with our platform, we're able to say, yes, you made your schedule on time. Yes, you're keeping cadence with the recommended programming from your physician, or no, you're not. And then, on the back end of that, we're able to say, for those patients that followed the programming based on the data that we received, this is the outcome. And for those that haven't, this is the outcome. And then you can start to get into sort of understanding what the impact of certain clinical activities are on the patient's health outcomes.
So where's that data the most valuable for? Is that for, the managed care organizations? Is that for, who is that data most critical to?
Yeah, I mean, it's valuable to all of the stakeholders, right? To the hospital, their main objective is to prevent unnecessary ED utilization. And as I mentioned earlier, a lot of, especially in underserved communities, a lot of patients use the ED like a primary care office.
Right.
So their objective is to use the data in that way to keep costs low. From, your comment, the managed care organizations, their main objective is just to keep people healthy in general, right? So there again, they can use the same data, but in a different manner to sort of get ahead of problems before they happen. And all of these objectives sort of align in the vein of keeping people healthy while providing the most appropriate care at the lowest cost. So depending on where you sit in that value chain, the benefit of the data is different, but I think it all points towards the same end goal.
Right. And I think a lot of the hospitals, now that they're getting, penalized for readmissions, and, some are getting incentives, I think, I wouldn't say it's across the industry right now, but I think that, there's definitely parts of the country where, penalties are hurting and they're having to do things, or incentives are helping them to, drive adoption in this area. Are you seeing some of that as well?
Yeah, no, absolutely. I think the main reason for any change in healthcare, right, is regulatory driven most of the time. The move by CMS to transition from fee-for-service to value-based care, we know that private and commercial insurers tend to follow what CMS enacts, about 18 months to 2 years down the road. So definitely it's what's pushing people to make these moves and organizations to make these moves. I think the challenge just comes down to the ability from an economic standpoint, from a human capital and talent standpoint, to stand this stuff up. That's where you start to see the haves versus the have-nots in terms of who's able to do this today versus who's kind of figuring out how to do it tomorrow.
Yeah, and I think an important point that you made earlier that, we see a lot of as well is patients are using the ED as primary care, right? And so on your kind of, especially on your Medicaid side and even your Medicare side, the ED is open 24/7, right? So if you're not feeling well, a lot of the payers from like the insurance standpoint, you may be using telemedicine app or you may be going into a retail clinic. But for on the Medicare, Medicaid side, it's typically you're going into the ED because that's what they cover, right? And so if we really start looking at kind of that channel of choice and that patients are all about now convenience, that really doesn't, that convenience factor and that engaging with healthcare in the way they want to engage with healthcare through convenience and technology. It doesn't matter if it's insurance, if it's Medicare or Medicaid, everybody lives kind of in that world at different levels and so forth. And so I think the one thing as we look at value care and as we look at proactive care, things like that, if it's really hard for somebody to get transportation to make their appointments with their primary care physician, by default, they're either going to be calling an ambulance at some point to go into the hospital, or a family member is going to drop them off in the ED, right? And so I think when we talk about value care and some of the stuff you guys are doing from a data perspective, really looking at, okay, this person, has had these changes in the last, week or so, and this doesn't change, they're going to end up in the ED, and it's going to cost a huge amount of money for that to happen. So using that data and kind of figuring out that, that last mile, could be telehealth, could be getting them transportation to clinic or, primary care, things like that. Where do you see people that are really kind of starting to think outside of the box kind of in that value chain. We talked kind of about that value chain, whether it's, ACOs, MCOs, FQHCs, things like that. Are you starting to see folks that are really trying to think of more kind of proactive care? Or have you seen anything, kind of leading edge or more progressive than others? Or where do you see that headed?
Yeah, so I think that you're seeing a lot of new innovative ideas to close the gap on the last mile, as you call it, right? So I know here in Illinois, Blue Cross rolled out a food delivery service, right? And I think it's roughly $5 to $10 for a meal to be delivered to a patient that either has limited access to transportation or for whatever reason, there's no whole foods type grocer in their area. Yeah. I think you're going to continue to see more and more iterations along that line, and ultimately, what it comes down to is math, right? If it costs $5 a day to provide someone food, but it prevents a $2,500 ED visit once every 6 months, then it makes sense. And where that $5 is spent, if it's spent on actually delivering them food, if it's having transportation bring them to the grocery store, if it's on patient education about how to eat healthy during the day and throughout their life, whatever the ultimate mechanism is, I think you're seeing people starting to figure out and quantify what the benefit is versus the cost. And using technology is obviously the most effective way to institute a lot of these programs because it's low cost and highly scalable.
Yeah, absolutely. And Eugene, as we have long-term facilities, skilled nursing, a lot of the acute care and rehab facilities, the rise in home health, and have all these different data sources, right? If we're trying to look at a patient holistically, what are some tips that you would have for organizations, kind of anywhere in the healthcare chain, of what they should be thinking about when trying to gather data from all these different sources and things like that? What are some tips that you would have of, where they would start and what they should be thinking about?
You just previously, you and Nate were talking about new ways of thinking of how to improve care. And sometimes, old is new, and some organizations are smart to be looking at the old ways of doing things. So if you think about 50 years ago, it was common for doctors to visit patients at home. Yeah. We don't have this anymore as much. And so but some people are starting to think about, okay, how can we bring that home care without the doctor physically going back? So It starts with knowing what's going on at the patient's home. So installing things like sensors, having apps for Amazon Alexa that the patient can communicate with, and also, Alexa can listen and hear what's going on in the house. And if it's assuming the consent and privacy things are taken care of, you have a lot more information on what's happening, and you can make better decisions about the treatment protocols. And then hand in hand with that, once you're informed as a doctor of what's going on, having telemedicine solutions to be able to interact with that patient in a video call, for example, would go a long way. You leverage the data for your input, and then you interact with the patient via telehealth to make sure things are happening, the patient is following the orders, and just checking in on your patient. So enriching your data sources is probably one of the key things, as well as looking at your existing data sources and making them more consumable, more usable.
Yeah,
would be a good way to get into this space.
That makes perfect sense. And to close out the show, if we were to listen back to this podcast 3-5 years from now, from each of you, what are just one or two things that you think where we'll be in healthcare in the next 3 to 5 years that we'll be looking back on this conversation, kind of from a prediction of the future standpoint? Eugene, let's start with you.
Yeah, I think AI is the biggest opportunity. We are still early in that journey, but 5 years from now, if we are having this conversation, I bet it's going to be much further along, and these models will be a lot more useful and will be widely adopted. But also, I think just like with the cloud, we are now coming off the hype, and we are seeing practical applications. People are now thinking that it's real and it's time to get in. Same thing with AI. We're going to look past the hype. We'll recognize that AI is extremely data hungry, and people will hopefully stop underestimating this. And we'll have better solutions for dealing with all this data, especially the unstructured data that doesn't live in the EHRs. So down the road, AI will be much more widely adopted in the healthcare space.
Got it. And what about you, Nathan?
Yeah, so I think we've touched on in this conversation, right? Cloud, AI, telehealth. I see each one of those sort of verticals, if you think of them that way, getting more and more refined and more crisp in terms of delivering outcomes and being able to tie data to the health outcomes. So in 3 to 5 years, I think those will be much more robust. As Eugene mentioned, AI is sort of the holy grail that we'd love to get to. And I think, we have bots, we have sort of retinal and epidermal image recognition software and other automated type features that are helping. But, the challenges around data integrity, disparate system interoperability, and medical procedure pricing variability all pose really big hurdles to ultimately getting to a system that, can drive autonomously informed decisions on the most appropriate care for individuals. So 3 to 5 years, I think we're going to get a lot better at, the stuff that we're doing today, and potentially sort of unifying those different technological capabilities. The holy grail of AI, though, I think is still a ways out, but I can't wait till we get there.
Awesome. Well, guys, I really appreciate you being on the show. If you have any questions for Eugene or Nathan, feel free to submit those, and happy to get answers for him. To learn more about Eugene and what they're up to at Prime TSR, go to primeTSR.com. To learn more about what Nathan is up to at Clinify Health, go to ClinifyHealth.com. Gentlemen, thank you so much for being on the show. Really appreciate and enjoyed our conversation today.
Thanks for having us.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.